and welcome to Health Talk here on AM 1270 and 96.5 FM. KXBX, I'm Paul Thomas. I'm here today with Bill Kearney of Northlake Medical Pharmacies, and we're going to take it a little slow here on the intro. Bill, I see the wincing in the face and pain.
Well, I took another little spill.
Oh, no. When was this?
Tuesday night, I went home and tried to fix my gate. Somebody had driven in as the gate was closing, and it burned a fuse out. So the gate was all the way open, and there's a palm tree right next and a great big rock to get back to the control panel. And so my wife told me to get a fuse in town, and I did. And all of a sudden, as I stepped towards the gate, there was it's all covered with gravel there, but there was a gopher hole underneath there.
Oh, no.
When I stepped, I fell in the gopher hole and into
oh, boy.
Just these palm needles all over everything. And then I flipped over on my back where I'd broken the ribs, and I just got out of the hospital. I had another broken rib, and my lungs are clear, but
oh, my goodness.
A lot of pain, so you just...
What is going on?
I said to my wife, I said, you know, what is God trying to punish us for? Were we this bad when we were growing up? Because, I mean, it's just one thing after the other. And then when I went into, Dr. Stanley was my doctor, and we went in to see Dr. Reddy, who's the head of radiology, and he says, you don't have only 3 broken ribs on your right side. He says, you've got, at some time, you've broken ribs, almost all your ribs on both sides.
Oh, my goodness.
So, you know, I've fallen so much, I don't know, you know, when that would have been. And, I mean, the pain was incredible, so, you know, you never know where it came from.
Wow.
All right, welcome.
Turn that off right there.
Yeah.
All right, let me close this out here. All right, there we go.
So, anyway, I got a...
We need to get you like a bionic suit. You know what I mean? Well, some sort of suit that's like, you know, armor and, you know.
Yeah, first people thought it would be, bubble wrap would be okay, but it doesn't appear that the bubble wrap will be enough, you know.
Not enough, yeah.
I mean, so I've got to be more careful. I got to fly out to Salt Lake to make a trip to some in-laws this afternoon, and Dr. Stanley was afraid that I'd had a collapsed lung and or a pneumothorax, and luckily the radiologist was there at the same time, and he said, no, you don't. You've got some other stuff going on in there, but we'll deal with that later. So anyway, a little slow getting up and down, and maybe a little bit unprepared for everything that's going on, but we're here to talk about your health, and of course we're always going to mention the impact of the fires and what kind of an impact that has put on lots of different individuals that have lost their homes. I had a friend that had a surgery in St. Helena yesterday, and her orthopedic surgeon had lost his house in Silverado. So every place you go, there is that kind of trauma to deal with, and several of the people I know have lost their homes. So there's a lot of stress, both physical and mental, with having to deal with what we are. And it's not over yet, so I feel pretty lucky that we had the first hot day yesterday and no new fires, and hopefully we'll get everything back in order. Of course, you know that it's flu time, and it's time for flu vaccines, and this afternoon we're having a clinic at the Bruno store from 1 o'clock to 4 o'clock to give you the quadrivalent flu shot. So if you have Medicare or Medicaid or Partnership Health, or almost every insurance company pays for the flu shot. So you don't have to make an appointment. You come in and fill out one piece of paper. Diane, my pharmacist that works for me on the weekends, is going to be running the clinic. And we're hoping for a good turnout because we have a feeling, although it doesn't show that the flu has hit very hard yet, that it's going to hit hard. And that's why we got a stronger vaccine this year. But you can take it for as young as 3 years old and up. The people that haven't been getting it, it seems like this year they're getting it earlier than they were in the past. So we've been very busy the last 2 or 3 weeks giving flu shots and pneumonia shots for those people over 65, and of course Zostavax for shingles. And I just got while I was in a meeting yesterday, I got a bulletin from, I think it was Glaxo, which is a drug company, that they are coming out with a new shingles vaccine. I think it's called Shingles IRX or something like that, Shingle-Rix. And it has just been approved yesterday. It's been on the market in Europe and some other countries, and I don't know when it will be available here, so if you're due for a Zostavax shot, don't wait for that one to come out, because just getting approved is a minor step in moving forward. This one is different. The Zostavax shot that most of us got before was a live vaccine, and it was about 60 to 80% effective, more like 67% effective, although it runs in my family, and I have not received, I've not got the shingles vaccine since I've had the immunization. My sister, however, has, and it's long going on. It's been going on for 6 years now. So you don't want to get shingles, and the older you get, the more apt you are to get it, but it doesn't have any age that says that you won't get it until you're 60 or 50 or whatever. There isn't any. People can have it at 14 or 15, even younger, and there's nothing you can do to prevent it. Most everybody's had smallpox, and the older people that are getting the shot for sure have had smallpox. Almost everybody had, if they didn't get it, they had smallpox parties and tried to get exposed so they would have it in their system to keep from getting it. This new vaccine is less expensive than the other vaccine. The one that's out now was a live vaccine, and it costs around $230, $250. The new vaccine that's coming out will be about half of that price, and it is 2 shots, not just 1. I went online yesterday to try to figure out if they would give any criteria on how the shots needed to be separated. Do you give one in one arm and one in the other arm, or do you wait? Do you wait 30 days, 60 days, 6 months, a year? How long do you wait before you get the second shot? But it will be out. They will be advertising it like crazy. The marketing people say the sales the first year will be into billions for this company, and they're a very successful pharmaceutical company. It's not like they need to put billions in their account to make them healthier. But it will be out. We've talked about it several times on the show, and had no idea what the progression is. It was supposed to come out this fall. Well, it did get approved this fall in October, but when they will be up to speed manufacturing it, we'll just have to see. Since it's been approved in other countries, I'm sure it's a matter of just getting a permit to be available to make it in this country, and not that there would be a slack in the preparing that or getting it ready to manufacture. I'm sure many of it has been. Also, those other shots that we talked about, the Pneumovax, the Prevnar 13, the Tdap shot for tetanus, those all can be taken care of by us. The only one that we can't do is yellow fever. That's because the state restricts that to, I believe it's Safeway in this county. I had a patient that went in to get a yellow fever shot because they were going to the Amazon, and the pharmacy told them they didn't need it. However, the CDC, the Center for Disease Control, says you do need it. So there also was some information saying if you were over 60, you were at more risk to develop side effects. However, it wasn't contraindicated, meaning they didn't say you couldn't take it at all. They just said the incidence of side effects could be greater at our age level. So I advised the patient that they could go ahead and do it with some risk, although we couldn't give them the yellow fever vaccine, or they could wear long sleeve shirts and use insect repellent and probably be okay anyway. So that's a new thing that's going to be in the protocol for immunizations for pharmacists, but the yellow fever will be limited. It's quite expensive. It is, there are side effects with it, as you know, and but they shouldn't be too great. They should be worth getting them for protection. It's an option that you have when you're over 60, whether you want to do it or not. If you wanted to risk death, or if you just wanted to be diligent about covering up, that you could do that. So just be aware that it's something that in some countries they need. You could understand why the Amazon trip would really require that, and in other special parts of the country. We never have a show that we don't talk about opiates. And there are new state and insured limits on the very beginning script you get for an opiate. And it will raise some questions about how you're going to manage acute pain. Acute pain is something that just comes on, for example, like my ribs, and it will be gone shortly, hopefully, and then you don't need the medication anymore. Some payers, and over a third of the states, now restrict the first-time opiate prescriptions, such as limiting it to a 3 to 10 day supply, or capping the doses to they can be 10 or 15 or 30. About half of the post-op opiates aren't used, leading to leftover meds and potential misuse or diversion. Plus, 1 in 7 patients who get a second prescription are still taking them a year later. And why do we do this? And the reason we do it is we know when we had a procedure that we were going to hurt. If it's a surgical procedure, if it's a dental procedure, and we don't want to hurt. We want to go back to work. We want to sit in front of our TV and drink beer, whatever you do. But the problem is that we may not have that kind of pain initially, and we may not need it at all. I just talked to one of our friends yesterday that had a knee replacement repaired, and they gave her a choice of a couple of different opiates, and she's only taken 2 since she's been discharged, and is probably going to throw the rest away. So people have been coming in since this restriction and asking them what we recommend for a non-steroidal anti-inflammatory, or Tylenol instead of an opiate for most acute pains and minor surgeries and those kind of things. Ibuprofen 200 milligram and acetaminophen, or Tylenol 500 milligram may work better than post-op opiates such as oxycodone and Tylenol. If an opiate is released or needed for acute pain, be assured that a 3 to 7 day supply is often enough, and not to expect complete pain relief. When I broke my back, had a surgery to re-break it in October of 2005, I was given a prescription of oxycodone with acetaminophen. I think it was Percocet. I went back after my next appointment, and I was given another bottle of that. And then when I went back the third time, they gave me hydrocodone with acetaminophen. I was pretty sure that I was just going to be hurting all that time because they broke my back, because it was healing incorrectly. Well, that wasn't happening at all, but that's what is into our heads when we have a procedure, whether it's a car accident, whether it's a disease we get. whether it's a surgical procedure, we automatically think that we're going to be in pain, especially if we take a pain medication and it doesn't quite work. We just assume it will be worse if we don't take it. And that isn't always the case. I talked to one of our patients the other day that had a hip replacement. Doctor prescribed him oxycodone, never took a pill. I think that embedded into our minds are the fact that we don't want to hurt and we have something there to keep from hurting, and why not take it? Well, there's a lot of things that could happen. For example, falling like I did. I didn't happen to be taking an opiate, but that makes you less steady to go. There are ways where you're just unstable walking, and that even makes it worse. If you take the opiate with liquor or alcohol, that's going to make it worse. The directions now on these on hydrocodone, for example, instead of oxycodone, is 1 tab every 6 hours as needed, and they usually give up to 20 doses of 50 milliequivalents a day, and the risk of fatal overdose doubles with every dose of 50 milliequivalents or higher compared to less than 20, and that's the narcotic that they're talking about. State laws are different with filling these prescriptions. If a C2, which is one of those prescriptions that has to be emailed, or we call it e-faxed, or a handwritten prescription each time, is going to be highly discretioned for people looking at your file and seeing whether or not this is a consistent thing, or whether you know what the diagnosis is, which isn't always easy for us to get the diagnosis. We just had one of our pharmacies inspected by the DEA, and they were actually going after the physician, but because we were the last link in getting the prescription to the patient, we were also jeopardized and paid a fine for not having the diagnosis. Well, our responsibility isn't really to get the diagnosis. That used to be the number one thing that the physician would not give the pharmacist as a diagnosis. And I guess because of PPI, private health information, or PHI, they decided they would be difficult in doing that. They should be willing to give us that diagnosis, so that would more legalize them and legalize us too to go ahead and fill the prescription. We still call the Department of Justice when we fill a prescription. We had a person the other day that had 3 prescriptions of hydrocodone with aspirin, Vicodin or Percocet, from a dentist. And every time she had a dental extraction or root canal, she would get 15 medication pills. So we go to fill the prescription, and they were notified by the third party who had written the prescription that the DEA has said we couldn't fill any medications for this patient, and we weren't going to be allowed to fill it. Well, first of all, it was the FDA, not the DEA, and they have no right to tell a pharmacist they can't fill a prescription if it's within the legal guidelines. Sure, we don't want to see people get addicted. We don't want to see people get hurt. We don't want to see people take these drugs and they think they were getting it handled okay, and they really aren't. So, but we want to also be fair to the patient. So in this case, unless someone, either the provider that wrote the prescription or the DEA, would tell us we couldn't fill it, we would go ahead and fill it, as we did. So it's a little confusing when you get to my side of the prescription counter and get these conflicting notices about the DEA and the FDA coming in telling you that you can't do this. And of course, their position is to generate revenue. So if they can fine you $5,000 because you don't have a diagnosis or you don't have anything from the Department of Justice, then you pay the fine. Not a glorious position to be in, but one that has been adopted recently in order to generate more revenue and then show the police community and the law enforcement people that you're doing everything you can to stop the chronic control of opiates. After the deal on 60 Minutes the other day, they have perked up a lot about opiate prescribing and opiate distributions, and they're going to really crack down more, and we will feel it. So it's difficult to put your hands around something like this and realize that it's not for the betterment of you personally, but it may be the betterment of the population in general. So you're going to have to just adjust to the kinds of things that are happening out there and work within the system, or you won't get the medication at all. October is National Pharmacist Month, and you will see a lot of people being involved in dispensing pharmaceuticals that are having clinics like we're having today for flu shots, are doing brown bag checks, which we provided a pharmacist for Sutter Lakeside at the fairgrounds a couple of weeks ago, and all kinds of information about how to make yourself healthier. And one of the things that was in the preventative health for consumers was 5 ways to protect yourself from a stroke. And as you know, a stroke can either be a stroke that causes bleeding, a cardiovascular stroke, or it can be a temporary block of blood flow that can cause you to die. The first thing you would do to control and protect yourself from a stroke, and as we get older, we get more susceptible to these kind of things, is to control your blood pressure. There's over 75 million Americans who have high blood pressure, and only half of them have it under control. I went to a physical last week, and I went to a dental appointment this week. They both took my blood pressure. One was 116 over 74, and one was 113 over 64. Great blood pressure results. Of course, I do take medications to prevent that from causing me a problem. My father died of a stroke. My mother died of cancer and a heart attack also. So if your readings are higher than 120 over 80, or if you're 60 years old and older and have no other cardiovascular risk benefits, such as diabetes or high cholesterol or smoking, you don't need medication unless your systolic reading is at or above 150. According to the new guidelines from the American College of Physicians and the American Academy of Family Physicians, you're at a high risk for heart disease, or you have a history of heart attack or a stroke if your systolic is 140 or higher. That recommends considering medication. You can usually control borderline blood pressure, which is 120 to 139 over 80 to 89 milligrams. So with lifestyle changes, you can really control that, like we've talked to you about many other drugs. Your other health issues, like high cholesterol or diabetes or sleep apnea, depression, they all increase the risk of stroke. If you have any of those conditions, you need to ask your doctor to assess your heart disease and stroke risk. You can also check the ASCVD risk estimator at cvriskcalculator.com. This ensures your blood pressure and cholesterol and diabetic status and moves to determine your 10-year risk. That 10-year risk is called a CRV, a cardiovascular risk. And for high cholesterol, your doctor might suggest quitting smoking or losing weight, being more active, drinking alcohol in moderation only, and controlling high blood pressure or high blood glucose. If that's insufficient after 3 to 6 months, consider a cholesterol-lowering statin drug, especially if your LDL or bad cholesterol level is higher than 190. My high cholesterol, my LDL, in my lab test was 74. My regular cholesterol was 120. My LDL, which was the good cholesterol, was 26. Now, there isn't any medication on the market to stimulate your LDL, your good cholesterol. So, and there are some that say your cardiac risk is just as great with a below average LDL as it is with a high average LDL. And that just hasn't seemed to be the case with me. Of course, if it does happen, then you second guess and say, whoops, I should have done something to get that HDL up, but there's no medication to do that at this point. If you have diabetes, talk to your doctor about lifestyle steps if needed, medication to keep your A1C at long-term glucose levels. The A1C measures your blood level for a period of 3 to 6 months. So you can cheat all you want before going to the physician, and then when you get there, maybe your AIC is right where it's supposed to be, below 7, but maybe it's higher. And because it remembers for 3 months to 6 months, you can't all of a sudden be a good guy and eat the right kind of foods and expect the A1C to change because it's remembering everything. So I would just take every opportunity I had. I'd check my pulse, atrial fib, which is kind of a quivering, irregular heartbeat, affects people 5% of older than 65 and 10% older than 80. You need to take your pulse monthly. Tell your doctor if you notice anything odd in your sensation in your chest. You may need an anticoagulant. I had a person yesterday that I was doing the Medicare D for that was taking a drug for Xarelto for AFib. And because it isn't a generic, it was going higher and higher in cost, and it was costing her drug plan to escalate in price. She'd hit the donut hole in about 6 months, and then we'd be paying the premium price all the way back. So you want to make sure that you understand what you have to do in situations like this, and then follow up. In our attempt to help her out, we looked up some substitutes and then ran the price of the substitutes, and they also were expensive, but she saved maybe $20 a month by going that direction. We're going to take a break, and when we come back, we're going to talk about the stroke that you may not recognize. Hi, my name is Bill Kearney, pharmacist and owner of Northlake Medical Pharmacies. Do you take non-prescription medications to relieve your headache, fever, or arthritis? If so, you're not alone. Americans consume more than 50 billion non-prescription over-the-counter medications each year. When taken as directed, they are safe and effective, but they're still serious medications. At Northlake Medical Pharmacy, our pharmacists want you to know they are always available to talk to you about your medications, including over-the-counter medications. So talk to our pharmacists for your good health. We also want you to know that we care about your health. By working together with our pharmacists, you can get the most out of the medications that help make you feel better when you're sick or help keep you healthy. So remember, talk to our pharmacists for your good health. North Lake Medical Pharmacies, with 2 locations to serve you, on Hill Road next to Sutter Lakeside Hospital, and outside the Bruno Shop Smart at 347 Lakeport Boulevard.
This is the Caltrans Road Information Bulletin for Lake and Mendocino County State Highways for the week beginning Friday, October 20th. In Lake County on Route 20 near the Upper Lake Bridge, weekdays expect 5-minute delays. On Route 29 near Coal Creek Road, weekdays expect 10-minute delays. And on 175 near Arroyo Vista Road, weekdays expect 5-minute delays. In Mendocino County on Route 1 north of Crispin Road, weekdays expect 5-minute delays. On Highway 101 from Ridgewood Ranch Road to the 271 Junction, weekdays expect some delays. On 128 near Big Oaks Drive on the 23rd, expect 5-minute delays. On 162 west of Pukini, weekdays expect 10-minute delays. On 175 near the Lake County line, expect 10-minute delays. On 253 near Singley Cattle Pass, expect 15-minute delays weekdays. And on 271 at Piercy, there will be a full closure. That'll detour onto 101. That wraps up the bulletin. Like us on Facebook for more updates and info on the type of work we're doing. It's Caltrans, District 1.
The Lake County Hunger Task Force, Lake Transit Authority, Clear Lake and Lakeport Grocery Outlet, and North Coast Opportunities Community Action are accepting donations of non-perishable food items for the 18th annual Make a Difference Day food drive. All food collected will be distributed locally, and all items will be used to stuff a bus. Saturday, October 28th from 9 to 3 at Grocery Outlet in Clear Lake and in Lakeport. Come join and help our community. All volunteers are welcome. Please register by calling 277-9227.
Raising your family, tending to your animals, growing your own produce, preparing for the seasons, living the country life. Hi, I'm Jody Henke, host of Living the Country Life. Catch me every Monday through Friday at 9:35 a.m. and 4:35 p.m. for ideas and inspiration for your place in the country. That's Living the Country Life here on AM 1270 and 96.5 FM KXBX.
We bring the community closer together, supporting business in every way. We're helping make your dreams come true, working hard for you.
The Lake County Chamber of Commerce would like to recognize their Member of the Month, Tom Lincoln from Lincoln Levitt Insurance Agency. Lincoln Levitt Insurance Agency insures hundreds of local and out-of-county businesses, providing such coverage as fire liability, business auto, workers' comp, umbrella liability, director and officer liability, and group benefits. It also provides a full line of insurance products to local farmers and agribusiness owners. To request an insurance review, Tom and his staff are located at 650 North Main Street in Lakeport. They can be contacted at 263-7162 or through the website at lincolnlevitt.com.
Lake County Chamber of Commerce, we're steady and strong, help us shape the future.
Well, we're back talking about strokes. I just thought I'd cheer you up a little bit, talking about if you can accelerate your death. No, we were last week we were talking about Paul's Halloween decorations at his house, and I went by there. It looks,
did you see it?
Yeah, it looks good. Yeah. And then
It looks better at night. I mean, with the lights on
Yeah.
and the strobe lights and stuff. But yeah, it's funny. We get the people that drive by and slow down and check it out. And, we don't get many trick or treaters up there, but
No, we don't either. We live out by Buckingham, and I think there's one house that's decorated. Everybody's older, and their grandkids don't come back for Halloween.
yeah.
So it's, but anyway, it's going to be a lot of fun. Is it on the 31st, Halloween?
Yes, it is,
It
and
is.
it's a Tuesday this year.
Yeah.
So those midweek Halloweens are,
Yeah.
probably even less people will be coming by. My son, who's 9, I'm quite shocked, but doesn't have any interest in going trick or treating anymore.
Really?
Yeah, he just wants to actually, what he wants to do, he said, is he wants to jump scare all the kids that come by. So he wants to hang out in our graveyard, and as the kids come up, he wants to jump out and scare them, and then hand them out their candy. So.
I did that one time at the fairgrounds. The Lions Club, the Early Lake Lions, did, and I was in a casket.
Yeah.
And they'd walk by, and I'd jump out of the casket.
Yeah.
Shoot.
You got to be careful because somebody's going to get scared and take a
Oh,
swing
yeah.
at you or something,
Well, I mean, right now they could just pound me right back down in the casket and close it up, and you'd never hear from me again. So,
Yeah.
Yeah, I was thinking I wouldn't be back for Halloween, but I will. So we decorate our house for Halloween. My wife decorates for every holiday, so lots of electronics, but nothing like Christmas or Thanksgiving. But well, before we took a break, we were talking about a stroke that you may not recognize, and I think consumers maybe doesn't have this right in one sense. I think more people have heard of TIAs than they may think, and those are mini strokes. And the TIA stands for transient ischemic attacks, and they occur when the blood flow to the brain is temporarily blocked or dramatically reduced. The symptoms, which last for less than 5 minutes usually, but can last for 24 hours, are the same as those of a full stroke, such as sudden numbness in the face, arm or leg, usually on one side, and trouble speaking or seeing, dizziness, loss of balance. But many people who have TIAs don't even know what's happening. 1/3 of the United States adults have had mini stroke symptoms. Only about 3% called 911, according to the American Heart Association in 2017. So if you think you might be having a TIA, get to the emergency room immediately. It's essential to be evaluated quickly so that doctors can determine the cause of the TIA or full-blown stroke. They recommend a procedure to prescribe drugs to control the blood pressure and cholesterol and prevent more blood clots. It also may be key to follow stroke prevention steps, as some of what we just talked about. More than 1/3 of the people who have had a TIA but get no treatment have a major stroke within 1 year. My sister, who's I just talked about, had shingles for 6 years, got a stroke because of that. So you just can't be too overprotective. Now, there are people that take care of themselves, do the best they can, and kind of exceed at diet and exercise, and they still could just drop over with some sort of a cardiac arrest. So the risk of side effects from medications as you age becomes an issue, and I don't know everything you need to know about taking medications when you're older, as I am, and one of the things that I just did was change physicians because my physician was retiring, and at that same time I cut away 3 different medications that the physician didn't think I needed and I didn't think I needed. But what happens is these unwanted side effects that you get, you hear them rattled off on the TV in about 6 seconds, telling you you're going to have constipation, diarrhea, dizziness, drowsiness, dry mouth, nausea, upset stomach. And they say it as fast as they can, or they sing it as fast as they can, and you don't even pay attention to what kind of a side effect they're talking about. You know, as you get older, you're twice as likely as other adults to suffer an adverse event, suffering from serious enough to require a trip to the emergency room, and 7 times more likely than younger adults to be hospitalized. If I'd have been, well, maybe smarter, I was going to say 10 years younger, or 10 years older, maybe I would have gone to the hospital when I fell, because my hands and arms were loaded with those palm needles that we had to pull out with tweezers, and half of my fingers were torn in, not in 2, but good slugs out of them, and then when I fell on my back, it was an increased discomfort, and said, no, I can handle this, and thought I could, but I guess I was injured more than I thought. Also, when you get older, there's an increased potency that happens with medications. Your body often gains more fat, holds less water, And both of those things cause drugs to become more concentrated in the body, and medications can linger longer in your system, which can further increase the risk of side effects. You've heard us say many times, if you're taking an X drug, which could be anything from a statin to a antidepressant or what, that you're probably going to be more slowly metabolized because of your age. And if you do something, as in some of these cases, to take grapefruit juice with it, it's just one of the things that produce an enzyme that causes it to break down less rapidly. It's going to continue to stay in your system longer, to the point that it may affect your liver or kidneys. So when it says those things on the side of the bottle and you don't pay any attention, and then one day you finally figure it out and you'd still been drinking grapefruit juice, and you all of a sudden have some elevation in liver enzymes, it probably was because of the grapefruit juice. So, you know, sometimes drugs that pose the most serious side effects may also have major benefits, and doctors refer to these as high-benefit, high-risk medications. You've heard me talk on the telephone, which, by the way, 263-5252, you're welcome to call at any time, that have told people that there's always, in any kind of medication, a benefit, and there's a risk, and you need to do the simple evaluation of the medication you're taking. On one side, put the possible side effects you could get from it, and on the other side, put the benefits that you could get from it, and then weigh the two with your doctor, with your significant other, maybe just in your own head, and figure out whether or not that it's worth taking the risk. At the top of that list are drugs that require regular monitoring to minimize the risks. Blood thinners like Coumadin and warfarin. Diabetes drugs such as insulin, and drugs used to treat diabetes, and drugs used to treat high blood pressure and heart disease, including arrhythmia, such as digoxin. Digoxin was an old-time drug for heart arrhythmia, and it's still very effective. But digitalis, the plant that digoxin is made from, is highly poisonous. And if you take too many of these, and the reason I talk about this, many times we don't dispense near as much digoxin as we normally have in the past, but many times when a physician writes a prescription, it's one tablet QD, meaning every day. Some people make that dot after the Q, and it looks like an I, and then the clerk or the technician types it, and it says take one tablet 4 times a day for arrhythmia. That is going to poison that individual. Now, the doctor didn't write it incorrectly, he just didn't write it clearly. And then it becomes the responsibility of the pharmacist to find that error and send it back to the clerk or the technician and say, this is digoxin, this can't be taken 4 times a day. Maybe in the very beginning when they're digitalizing themselves on the medication, but it's not a drug that is normally taken any more than once a day. Opiate painkillers are also more likely than other drugs to cause dangerous side effects. For seniors, especially taken long terms at high doses, oxycodone with acetaminophen, such as Vicodin and generics and other opioid pain medications, commonly cause such nausea, drowsiness, fuzzy-headed. Even when taken as directed, taking opiates can lead to a physical dependence and a drug overdose and probably death. That's why all of the information now and stress to pharmacies and family members is to have a Narcan or naloxone syringe So if anybody in your family is shooting up or taking high doses of pain medications, and you found them kind of doped out, the chances are if you give them the naloxone, they will come right back around and be just fine. Unfortunately, what that has done is caused addicts to secure naloxone on their own, and then when them or one of them friends ODs, they give it to them. Now, people say, isn't that great? We saved a life. Well, in situations like this, what it's done is said, I don't need to be careful anymore. I've got Narcan. I can reverse the effects of that med, so I'll take the 15 minutes of being loaded and then shoot myself up with Narcan, and I'll be okay. So it's kind of like the Plan B pill for abortion. That pill, it's a birth control pill that's over the counter now, and it was to save somebody that just had been raped and to get involved with the fertilization process and not produce an offspring. And we have people who get that drug, once a month because they're having sex, they're getting pregnant, and then they want the Plan B to reverse that. So you'll just have to weigh out the good and the bad. There are things, I'm not a happy camper about all the marijuana being issued, and we really don't know what it can do to you. Now, I've been on panels, I've been on advisory boards, I've been on national boards talking about this issue, and we haven't come up with a lot of good answers. There are isolated cases where it works, but the amount that's going to be sold and the amount of money we're going to put in the tills for permits and for selling marijuana is going to be huge. You need to manage your meds wisely. At every doctor's visit, ask for a review of all your prescriptions and over-the-counter meds. The chances are they don't know everything that you're taking because you've never told them. Your doctor might also recommend stopping at a drugstore or stopping taking a drug that's no longer needed and another drug in place of it, or discontinuing that drug altogether. Keep a list that has everything you take, dosages when you take them, the shape and color of your meds, the name of the prescribing physicians, whether you should take it with food or drink, your pharmacy's phone number, and any allergies that you may have. This was especially critical during the wildfires in the North Bay. There was nothing left of their homes, and they had to go to Tuttle's Drug, which was in Sebastopol, to get their prescriptions filled, and we were ordered by the state of California as well as several insurance companies to give you a week's supply until you could get to your physician. And the problem with the physicians are many of them, those people, lost their houses too. I think Sutter lost over 30 physicians' houses, and I'm sure Kaiser was more than that. You need to understand the side effects and warnings. Then when we dispense the medication to you, we give you a list of the risks involved and what those things are. We can't possibly cover 4 pages worth of side effects for you, but what we tell you to do is to review the meds that you're taking and be aware of what those side effects are. And if you start seeing those show up, get in touch with your physician or pharmacist and find out. We will normally tell you, your physician needs to tell you to stop taking it. However, if you want to taper it off, we'll give you a little chart or tell you on the phone on how to taper yourself off that medication until you get to the physician. You can usually tell after the first or second time of not taking it if you feel any different as far as what this drug was supposed to be doing. If your blood pressure stays the same, if you don't have heartburn anymore and you're taking a PPI, you need to skip alcohol. Mixing it with certain drugs can worsen dizziness or lightheaded effects or increase or decrease its potency. Now, there's a section in here about how much alcohol should I drink. Without looking it up, I'm sure it tells you that 1 drink for a female, a small glass of wine, and 2 for a male is a good bet on a daily basis. But don't mix it with drugs. Doing so can lead to withdrawal and worsen the condition it was supposed to treat. I had a person call me the other day and wanted to know if they could get an increase in their dose of alprazolam, which is Ativan. And I said, what dose are you taking now? And he said 2 milligrams. And I said, I can barely understand you. I said, I'm struggling to understand what you're telling me, and I would suggest you not taking any more of this drug. You're obviously overdosed, and the individual was taking other drugs also. And I said, first of all, I wouldn't fill your prescription. Second, I wouldn't call your physician. And third, if I did call your physician, I would tell them that you're highly overdosed and wants an increase in the medication. Excuse me, and we weren't going to do that. So the last thing that, as you age, as many of us are, there's a criteria that you've heard me talk about many years ago when I was doing long-term care facilities, called the Beers criteria. And it was published by the American Geriatric Society for a list of drugs that people over 65 and older should avoid because they may have limited effectiveness or serious side effects for older adults. And they include anti-anxiety drugs, diazepam, which is Valium, alprazolam, which is Ativan, alprazolam, which is Xanax, and Zolpidem, which is Ambien. Anything that slows down your central nervous system, that's a central nervous system depression, they suggest they don't want you taking Benadryl, they don't want you taking Sominex, they don't want you taking any kind of antidepressants. They have, as far as they're concerned, if especially this came out while we were working in long-term care, and we had to utilize their criteria and write a report on every patient that was using this medication, and then approach the physician about it when they look at our monthly notes. Well, some physicians didn't want to change anyway, and so it affected us as insurance benefactors, so insurance wouldn't pay us as much if we gave them those medications. And then the facility, if they didn't get it changed, they were also involved and discredited some by Medicare by not following the formulas that they had gone forward with. Now, some of these people have been on these drugs forever. If you remember last week, I was talking about the people that a friend of mine that was a motorcycle rider, and he gets up and he hurts day and night. He's probably broken every bone in his body a couple times, and his physician just said, I'm not giving you the pain pill anymore. And he says, well, what am I going to do? And she says, it really doesn't do any good. Just get off of it. Now, that situation does exist with some people because they build up a tolerance, and they're just not taking enough to be effective anymore. But also, there comes a point where they need something, and the anti-inflammatories don't work. Would you rather them be on steroid? A steroid which actually affects their immune system where they're not going to be nearly as strong to fight off pneumonia and those kind of things, or you're going to let them take it and have some relief. Even with cortisone and steroids, you're going to have side effects such as affecting your eyesight eventually, affecting certainly your size. You're going to balloon up like you never have before, and you're going to look like the Pillsbury Doughboy. So, you know, there are side effects with all kinds of medications, even aspirin. And I've talked to you before about if aspirin came out today, it would be on prescription because it's the strongest anti-inflammatory we have, but it's also the best one we have and the most side effects that we can have. So as well as affecting your immune system, it can affect your eyesight, it can affect your bones, making them more brittle, and many side effects go along with cortisone therapy. When I first started practicing 50, 60 years ago, there was, you could get 100 cortisone or 100 prednisone for less than $3. And it was on the competitive list. So everybody, and if you've never taken a steroid, when you take it, it takes care of many of your pain that's caused by inflammation. But it also has those side effects that are eventually going to get you before the disease gets you. So just be made aware that everything you take, ask your pharmacist or your physician if you don't think of it when you're there, when you get home, and we'll go over that white document that we have for you. Again, we want to remind you that we have that flu clinic at Bruno's this afternoon from 1 o'clock until 4 o'clock. You don't need an appointment. Come in, fill out the paperwork, which is 1 page. We will give you an immunization if you need Pneumovax or Tdap or any of those things at the same time. Let us know. We have been getting calls from one of our competitors, CVS, that is calling the patients and telling them that they have to come to them after Kmart closed. That's illegal for them to tell you that. That isn't the case. The situation is you can go any place to get your prescription filled. And the pharmacy or physician isn't supposed to tell you you have to go there. So you do not have to go there. You can come directly to us if you have a transfer prescription, whether it be from CVS, Walmart, Safeway, Kmart. We will fill those prescriptions with you. We also will deliver to you if you give us a day's notice, and it doesn't cost you anything to deliver to you. We do Lakeport and East Lucerne, Upper Lake, and the Rivieras and Buckingham. So I'd like to remind you we're North Lake Medical Pharmacies with 2 locations for you at 5136 Hill Road East across from Sutter Lakeside Hospital. Call us there at 263-6192. And outside the Bruno, Shop Smart. Call us there at 347 Lakeport Boulevard at 263-1328. Thank you, Paul.
Thanks, Bill, and we'll see everybody back here again next Wednesday for Health Talk right here on AM 1270 and 96.5 FM KXBX Lakeport.